How to check blood glucose in kids. Hi, I'm Dr. Nivedita Karthika, consultant endocrinologist and diabetologist. So, serial monitoring of blood glucose can be very challenging for individuals with diabetes mellitus, and especially for kids, it can be very tough. So, there is a gentle way to turn their fear into confidence, and that is our responsibility. Step 1. Address the why. As a parent, make the children understand that checking their blood glucose is not a routine chore which they do in their home or in the school. It is a scorecard that is an integrated measure of how well their insulin doses, their meal plan, and the physical activity are working together. And for children with diabetes, these values are very important because it helps the parents and doctors decide whether we have to change the insulin doses or their meal plan. Because too high blood sugars or too low blood sugars can alter their focus and make them feel tired and dizzy, and that is why it's very important to measure them so frequently. Regular checking of blood glucose allows them to proceed with their physical activities without any complications, and it also prevents the long-term complications of diabetes mellitus. Step 2. Guide your children to perform SMBG at school confidently. Children can monitor their blood glucose on their own in the school, but it has to be supervised by an adult, especially a school nurse or a trained teacher. Every step matters because missing a step or doing a step incorrectly can alter the blood glucose values, and therefore it leads to incorrect decisions about their management. Teach your child and ensure that the supervised adult follows these steps carefully. Number 1. Always wash your hands properly. It's very important to wash the hands before checking blood glucose because food residues, fruit sugars, creams, and also newspaper ink can alter the blood sugar values. Use soap and water always. If it is not available, use a hand sanitizer. Number 2. Use the glucometer and the strips carefully. Please always read the manufacturer's instructions, always check the expiry date, and store the strips properly. Number 3. Use the right amount of blood. Too little blood or too high blood can cause erroneous results, and always have a right amount of blood to check the blood glucose. Number 4. Avoid changing the settings of glucometer. Children may accidentally or even intentionally change the glucometer readings, and it is always important to ensure that they don't do that. Number 5. Always dispose the lancets carefully. It's very important to discard the used lancets into a secured container to prevent injury or any infection. And always remind the children that the number they see in the glucometer, it's not just a number, but it is a guide to ensure what they have to do next, whether they have to eat or whether they have to go for physical activity or whether they have to adjust their insulin doses. So lastly, be empathetic. It's very common to have pain, confusion, and lack of motivation, especially with children, and always help them and be with them. Please help your children to take charge of their own health with the 3 M's: monitor, measure, and manage. Because what gets monitored gets measured, and what gets measured gets managed. Thank you.